Welcome to the world of dentistry. I'm Doug Cook, and I've put together a number of patients to demonstrate the relationship of their symptoms to the oral cavity. This information was put together approximately 30 years ago by Dr. Reinhard Voll and his colleagues, who have found that 90% of systemic problems are related to or influenced by the oral cavity. He has combined the fundamentals of Chinese acupuncture with modern electronics for diagnostic information. What I'd like to do is to introduce my own case first. And this is the way it first started approximately in April. It started with the bumping of this bone and the elbow, which felt like a hornet stinging me. And then over the next week or two, the radiation of pain subperiosteally down the arm, up the arm, became more prominent and more severe. And as it followed through the rest of the month of April, the muscle became affected, in which the strength of the arm became compromised to a point where the weight of a telephone was extremely painful to just set it down or pick it up. At night, I couldn't roll over in bed without picking up my arm and moving it along with the rest of my body, because the arm was so weak it couldn't hardly move itself without severe pain. Also, in the extraction of teeth, the rotating action of the arm was to a point where I was concerned if I could continue with dentistry. This continued on until approximately the middle of May, in which we had a seminar, and Dr. Landerman, our instructor, said, let's check over the oral cavity and see if there's any influence with the teeth. His first thought was following the acupuncture meridian of the index finger, which passes along through the wrist, through the elbow, across the front of the shoulder, and up across the lower first and second molar, and across the first and second bi on the upper, and ends on the face, was that possibly some of these teeth on that meridian may be influencing the elbow. The first bicuspid was the problem tooth. I had this tooth removed by one of my colleagues, and the way that is done is a flap is made, the bone is removed, the tooth is extracted, and in this case, the two tips of this root broke off. I had the first tip removed. This appeared very healthy. Then the bone was taken out from in between, and the second tip was removed. At the end of this tip was an attached abscess. The next procedure is to take a round burr and clean the bone approximately 1 millimeter to 1.5 millimeters to make sure that the infection is totally removed. The flap was replaced and sewn into place. Within approximately 10 minutes after the tooth was removed, there was a definite improvement as far as the discomfort in the arm. As the week went on, it definitely improved to a point where you could feel the strength and the pain, both one subsiding and the strength improving. Over the next 5 to 6 months, the improvement in the strength of the arm got back to its normal form. This reinforced, of course, my feeling of electroacupuncture and how important it is to get this information out to the rest of the health profession. I will now start and continue with the rest of these patients. At the end of the last patient, I will then introduce you to some of the texts and the tooth energy chart and what I feel is important for all of us to do to continue this program. These are the films of Mrs. Hoff. As you can see, there are root canals on the lower left first bi and the lower left lateral. There's an attempted root canal on the lower right cuspid, the lower right first bi was removed previous to her coming to our office. Because of the severe pain, it was thought this was the troubled tooth. The area involved is in the bone of the lower first bi area. This was checked out with the dermatron. 3 surgical attempts were made at one sitting. After each venting of the cortical plate of bone, after making a flap, the area was checked with the dermatron, and the readings were not compatible with healthy tissue or a healthy condition. We went back in and did another surgery, remeasured. Still poor readings. The 3rd attempt was done at the crest of the ridge in the first bicuspid area. The readings read out as a healthy condition. She will tell you her own story.
Well, for 3 years I was having these awful toothaches. And I kept going to dentists because I was in pain. And I went to 4. I went to 1 in local, and 2 in Green Bay, and 1 in Marshfield. And each one of them told me, just by taking a picture of my mouth, that there was nothing there and there was nothing they could do for me. So I lived like that with pain. I figure I was going to live like that forever. And so then it got so bad that I couldn't open my mouth, I couldn't eat, I couldn't talk, and I couldn't. I just was shooting through my head, and the whole side of my face, it seemed to go from here through my ear and up to the top of my head. And I had learned of Dr. Cook from a lady that I met, and she told me what he did for her. So
could you give us a little more description of what she said?
She said that she had come to you with pain in her gum, and that you had taken it out, that you used sort of acupuncture or a procedure you used, and found out where it was and took it out. And she said, you should go there. She said, because anybody's going to find it, he will.
And were these any of these 4 dentist specialists?
Oh yeah, the one in Marinette was, and the one in Marshfield.
For oral surgeon?
Mm-hmm.
And what did they give you any specific reason, or?
No, they just said they couldn't find anything. In fact, it's the one in Marshfield I saw maybe 10 minutes at the most. And he says, he said, I'm looking at your x-ray right now. He said, there's nothing there.
Okay. And when did you notice the relief from the discomfort after the surgery was done?
After your surgery?
Yeah.
Right away. It was gone. And then the side was, and then I had another tooth. And then I had all my teeth pulled because it was starting in that other tooth. And you had to get some more of that out.
Okay, that's real good, Ms. Hoff. And I want to thank you for this interview.
Oh, that's all right. I thought I would live with the pain forever.
Yeah. No, it's the lateral and the first bicuspid. These were all removed subsequent to the cleaning up of the severe pain, and a lower denture was made. The patient is doing very well, and it's about 8 months post-operative. Would you give us just a little history on your health conditions before the metal in your mouth was removed, and we're speaking of the silver and mercury fillings?
Well, all my life I've had bladder problems. I've had surgery 3 times for it and never corrected it. And since I had my mercury fillings out, I am almost completely over it. And I'm sure that I'm going to be over it. And I've had a lot of trouble with sleeping, and now I sleep real good. And my energy level is much higher than it was before.
Also, you made some mention of joint discomfort.
Yes, I've been taking Motrin for arthritis for around 6 or 7 years, and I don't need anything anymore. I don't have any arthritis anymore since I had my fillings out.
Oh, real good. And did you go to an MD to have that diagnosed?
Yes, I did.
And what was he the one that put you on the Motrin? And what did that Motrin cost you per month?
$20 a month it cost me.
And now you're not using it at all?
Not at all.
That's wonderful. Okay, is there anything else that you can think of that you may have noticed?
Well, I think that's the majority of it. Like I said, I can't believe what my energy level is now since I had my mercury fillings out.
Do you find you sleep as much as you used to?
I sleep much more because I sleep when I go to bed now. I couldn't for so long. I just couldn't sleep.
What about the length of time of sleeping?
I go to bed about 10:15 at night, and I sleep until about 6:30 in the morning.
Did you sleep a longer period of time before to get the same amount of energy and rest?
I couldn't sleep. I'd just go to bed, and I couldn't explain it to anybody. I just couldn't sleep.
Okay. What about the eyes?
The eyes? I went to eye doctor in Rapids, a specialist, and he said he never saw anyone with such dry eyes. They were so dry, he said, at the point of infection. And he gave me some stuff to put in them, and it relieved it some, but it didn't help. But now, since I've had my fillings out, my eyes are straightening out. I even get tears back in them at times.
That's wonderful.
And I didn't have any tears at all. I was using artificial tears.
Well, thank you so much for this this impromptu interview, and we'll be watching you along to see how we're continuing with this improvement. And this time period is approximately how long since we took the silver fillings out?
It's about 3 months.
What was the reason that you came in to see us?
I was having flutters in my heart daily for about over a week.
And how often did those occur?
About 5 times a day, especially at night.
Okay, well, when she came in, we explained to her that there's a possibility that the areas involving the lower third molars and upper third molars, which we had extracted at an earlier date, I would say, how many years ago did we take those out?
I'd say about almost 3.
3 years ago. And at that time she had silver fillings in the mouth, which seems to prevent good healing. We performed the surgery on the 24th of August, where we opened up where the wisdom teeth were and cleaned those areas out with the number 8 round burr. Could you tell us the results you got there from that?
I came in at about 10:30 in the morning, and I had problems in the morning, and then after I had the surgery done, I had no problem at all.
And it's now the 30th of August, which is about six days since the surgery was performed. Have you had any noticeable change in heart rate like you had before
No,
since that time?
not at all. Everything seems to be clear.
Okay. We'll be following this case along at a later date to make sure we have a continuation of this result. Mr. Wood, if you just start out by giving us permission to use this for educational or teaching purposes, that would be necessary for us. Is it okay with you?
Well, I should say it is okay with me. I am happy to contribute anything I can to help your particular efforts in behalf of other people, as you have helped me.
Okay. Just give us a little history on what you noticed and what the things that you prepared for prior to coming here, thinking of your condition.
Well, back in May, I was in the throes of a very miserable life. I had discovered that I had a cyst in the roof of my mouth, and I had made arrangements to have this cyst removed by an oral surgeon, and he had requested that I have a examination by his physician, and made arrangements in the hospital to have the surgery done. And a friend of mine told me that he knew a dentist that was just a terrific individual, and so I thought I would get a second opinion, and I came to see you, and you were good enough to give me an appointment the 4th of June. And after your examination, and you took time to away from other patients I know to operate and take that cyst out of the roof of my mouth, but you took 4 teeth as well, and the thing that was so amazing about that surgery was the fact I had no pain. I've had teeth pulled before and suffered with some of them, but this was with absolutely no pain whatsoever. And then afterwards, I began wondering about this problem, because I had suffered with a back pain. I had sciatica in my hip so that it was almost unbearable. And I was just amazed when, after the surgery on my mouth, that the pain was gone in my hip and also in my back. I couldn't believe it at first. In fact, that first night that after their surgery, I slept well.
You mentioned that you took some medication or were taking that?
Oh, I took medication, yes. Prednisone. I took 5 grains of that every other day. And you remember you told me that it wasn't a good idea for me to take it, so I cut it in half. And now I don't take any at all. And I have had no bad results of having discontinued that. Mm-hmm. And I just feel that you have done a remarkable job for me, and I thank you so much.
What about you noticed your physical well-being as far as being able to do things, walk and work?
Oh, well, first of all, I want to tell you that I had problems with my urinary functioning, and I also had trouble with my bowels. This is cleared up entirely. I don't have the problem anymore. And when I work, well, my wife told me that I was a brand new man. And just for example, day before yesterday, I mowed the lawn, and I have a big lawn. And I always have help and to come in and do that sort of work, but I felt good enough, so I thought I'd try it. And goodness, there's uphill and downhill, and it took about 3 hours to mow it. That's what it ordinarily took. And I did it in 2 hours and 45 minutes, and I didn't feel exhausted either. I was tired, I'll grant you, but then I'm just amazed at how I feel now, Doctor, and I thank you from the bottom of my heart for everything you've done for me.
Okay, what I'm going to do now, I thank you very much for this interview. I will go ahead and show your x-ray. I'll take a picture of that, and then I'll narrate a little on some of the reasons for these different conditions, cleaning up according. All right, what do we have here now is Mr. Wood's full mouth x-ray, and we'll try and zoom in a little bit on this to show you the size of the globulomaxillary cyst over the upper right cuspid, lateral, and central, and slightly over the left central. There's also some residual infection around the root of the upper left first bie. In checking out the lower teeth, we found 3 teeth that indicated that they were normal vital teeth with the dermatron. As a result, we went ahead and continued with a full mouth extraction and placement of an upper and lower denture. The case seems to be going along very, very well. It's he indicated, the teeth that were involved were directly related to his problems of the bowel and the urinary tract and the urinary bladder, and of course energy level, I think, was greatly enhanced by the elimination of the infection. So Mr. B, go ahead and just tell your symptoms as they were when you came here before we did any dental work whatsoever.
Well, my problems were like arthritis and stuff in my joints, and I was doctoring at Marshfield Clinic, and with all the checking and stuff they did, they didn't find any sign of arthritis in my joints, but still yet I hurt, and so they even went to a point that they sent me to a psychiatrist, thought it was all in my head, and I knew it wasn't. And I talked with other people about teeth, and I thought that maybe the teeth were doing it, and I was to the point of getting all my teeth pulled out and see if that would help my joints. And then that's when I come to Dr. Cook. And then before I come, I thought it was my teeth, and so when I was about 50 years old, I had neglected my teeth, and I had a dentist fix all my teeth up, and a lot of crowns and silver fillings and what have you not, but I guess that I come to Dr. Cook as a last resort to get the teeth pulled out and see if that would help.
You made some mention of blood pressure, which we did check each time you came in.
Yes.
What was their findings at Marshfield?
Yes, and from when I was about 50 years old, and I started to develop high blood pressure, and I was on blood pressure medication from Marshfield Clinic for all these years. And then after we got started with the process here and what Dr. Cook did, my blood pressure went down to normal, and have not been taking any medication since.
Yeah, that's been holding pretty good. All right, we're going to just cut here now and go to the x-ray. This is just a full mouth panorex of the jaws, in which we found residual pathology in the lower jaw, where teeth had been pulled at some time span, as you can see by the healing of the jaw. The filling was extremely heavy, and the cost of replacement on, say, a full mouth rehabilitation program exceeded what Mr. B wanted to go into, so we decided that upper denture would be the best, but to maintain the lower teeth. Just a review now was with the use of the dermatron, we were able to determine that some of the metals were not the best for you, right, Mr. B?
Yes, yeah.
And also we found this pathology, or residual pathology. And then What was the results that you found after we cleaned up the mouth and jaws?
Well, the first thing, after about 7 days or 10 days, the blood pressure went down to almost normal, and it's been maintaining its. And we called our doctor in Marshfield and asked if I should stay on the medication. He said yes, but until I come in for my physical, but then I decided to go off of it. I don't like to take drugs, and my blood pressure has been maintaining its normal deal for the last
What about the
years.
joint pain now?
And
How soon?
the joint pain started to ease, and now I'm able to perform duties and stuff. There was a point there that I couldn't hold on a steady job and kind of the pain.
Yeah, you mentioned that you felt weak and
Yeah, weak and
just didn't have the pep and go.
yeah, weak and aching in the joints. It was like the pain in the joints are like when you come down with a flu or something, you ached all over. That's the kind of a aching I had, and now that's eliminated.
Okay, thank you very much for this interview, and we'll be following your case along at a later date. Thank you. Mrs. Dombreski, and she's going to give you the symptoms she noticed before she came here. Go ahead, Dorothy.
In March or late February 1983, I began to have very dizzy spells. Sometimes in the morning I couldn't walk from my bedroom without hanging onto the wall. And so I went to, I thought maybe it's something to do with my eyes because I wear glasses, so I went and had an eye checkup and everything was fine. And from there, I went to an ear specialist, and that turned out fine also. So I thought, well, possibly it could be something in my teeth. So I went to Dr. Cook and had my teeth checked.
And your profession was in teaching, right?
Teaching, yes.
And this is what disturbed you, that you couldn't finish your retirement.
That's right.
Okay, what we did, we checked her over with the Dermatron now. I'm going to just cut right here to go to her film. We'll take a look there now at the lower left wisdom tooth area, which looks perfectly good. And we'll just scan the film here so that you can see approximately what she has in there. Okay. Okay. Now we want to have you tell what happened after we did the surgery.
Well, after the surgery was finished and I went home in a day or so, all my dizziness disappeared. And so,
Well, you mentioned you had pain in the jaw, though, and the neck and the shoulder.
yes, I
With
did.
it? And that,
That disappeared
how
also.
many days?
I'd say maybe a day and a half.
Day and a half. Okay.
I just felt like a new person. I had a lot of energy again, and I felt I could continue my work.
Okay. And then we went ahead and removed the rest of the metals in the mouth after you retired. And the dizziness came back. Wasn't it after you retired?
Yes, and the dizziness came back. So I went back to Dr. Cook again, and in that same area, he opened it up again, and it wasn't as bad as the first time, but
Right.
he opened it up and cleared it out again, and then my dizziness disappeared again.
And what, you had some CAT scans done at the
Yes,
hospital?
yes, because I woke up one morning very dizzy, and my husband got excited and took me to the doctor, and the doctor thought maybe there was something wrong, so he sent me to have a CAT scan, and everything was fine. So I headed back to Dr. Cook again.
Okay. All right, this is Mrs. A, patient of mine, and she will give the reason why she came and some of the symptoms, and then we'll go from there to a shot of her x-ray so we can get a little better idea of what the mouth looks like, and then we'll come back to her for her results. Go ahead, Mrs. A.
After much reading, I came to Dr. Cook, and the reason I came was that I had a lot of burning and itching, and my feet hurt. And after I came to him, then he pulled out the fillings, the plastic, gold, and the albums.
Yeah, and you mentioned something about sleep.
And then, yeah, my sleep, I would only sleep a couple hours at a time, then I'd wake up with a burning and itching and feet hurting.
Uh-huh. Or there's one more symptom that you wanted to mention.
The one that I had in my left ear would always get real hot and burn, and since I've had the fillings out, I don't have that anymore. And I also sleep better at night, and my ears on my left side, I couldn't hear at all on the phone, but now I can hear. And I am not having the itching and the burning like I did before.
You mentioned about your feet too.
The feet aren't as cold as they were.
How's your overall general energy level?
Much better. I'm feeling a tremendous amount better than I did all the way around.
Okay, and we started you back in March 3rd of '86.
Yeah.
And now it's
October.
October
Yeah.
what is this?
20th.
20th today.
Mm-hmm.
Okay, we'll be following you along. As you get back to us, we'll just be updating our files. And thank you for this interview. Okay, this is Mr. S. And he came to me 10/11/85. And he's going to give us a little of his past history of his health problems. And we'll show the x-ray. And then we'll come back to him for his history from the time we pulled out the silver fillings and removed the teeth that were involved. Go ahead, Mr. S.
Well, I've had these headaches for a great number of years. I just don't remember when they started, but they were quite severe at times, and it made you feel just like you had no ambition to do anything. And I also had this tenderness in the back of my neck when you turn your head. And it seemed to be somewhat connected with the headaches. I'm not so sure what it was, but I went to quite a number of doctors. I had a CAT scan at Wausau. I was at Wausau to see a doctor, and then I visited my local physician, 2 or 3 of them, that couldn't seem to find what was causing the headaches.
And your energy level?
I had very little energy before that. It was just difficult to start a task or do anything.
Okay, that's real good. Now I'm going to just cut back to your film here. Okay, this is like sitting on the tongue, looking out of the mouth with the film, and there's a abscess formation on the cuspid, the central, and we found some residual infection in the jaw which had to be removed. Back to you again now. Just give us a brief rundown on the improvements or the changes that you've noticed since the silver was removed and the infection removed.
Well, I also went to the chiropractor here, and at the same time and relieved the pain in my neck and the headache. It has disappeared entirely. I have a much more, how would I say?
Energy?
More energy and
Do you find you sleep any better since you don't have the headaches? And
Well, yes, you always sleep better, you rest better, um,
But joint pain, you said
I
something
had
about that?
I had some joint pains in my shoulder, they've all disappeared now.
Mm-hmm. Well, that's real good. That's what we wanted to know. We want to see an improvement. Okay, we'll be following this case along at a later date. And thank you very much for this interview. Okay, this is Mr. H, and he is going to just give you a little background on a problem that he had. And then we're going to switch and take a look at the x-rays, and then we'll come back to him for the results we got after we performed the surgery. Go ahead.
Well, all I can remember is that I had arcing in between my teeth when there was stainless steel on there, and I had an earache, which I had to have my ear lappers down when it got cool, and I had an earache up until the teeth were pulled.
All right, the teeth he's speaking of is the upper right first and second bicuspid. Okay, we're going to switch to the x-ray now. Okay, this is like sitting on the tongue, looking out of the mouth, and the right upper first and second bicuspids have been removed. They were non-precious metal stainless steel crowns. We used the dermatron to determine that they were not the best for his health, and we also took out the upper wisdom teeth on the right and on the left, which are directly related with ear function. Mr. H, go ahead and...
Well, all I know is that after the teeth were pulled, my earache was gone, and I haven't had it since.
Do you have to use your ear flaps now with the cool weather?
No, no, just to keep my ears warm, otherwise I never have an earache.
Okay, okay, this is Mr. J, and he came to me on 7/8/85 for an examination and full mouth x-ray, which we will show in just a few minutes. I would like him to give us his physical symptoms that he had before we did the work, so we'll get some idea of what happened to him after we cleaned up his oral cavity. Go ahead, Mr. J. Just
Well, like I say, I've always had a problem with my stomach, you know, and appetite and anything with just a weak stomach. And
did you have pain?
no pain. There was no pain. So even nauseation, you know, you feel that.
Would this be during the day or evening or what?
All the time. I never had really any energy, you know, a lot of energy, you know. And until just recently, you know, since like I said we had all these fillings removed, you know, and then we had the teeth pulled.
We used the dermatron, didn't we, to check you out?
Yeah, yes.
And that gave us a clue to what we should do.
All the tests, yeah.
Okay.
And a couple of months ago, some guy asked me, you know, he said, oh, all them fillings out of your mouth, does that make a difference?
Yeah. Let's hold that now, and then we'll sift the x-ray, and then we'll come back and pick up the results. Another thing I wanted is approximately how many hours of work did you put in per week
I worked 70, 80 hours for the last 30 years. I've always been in business by myself, a restaurant business, which is hard, you know.
Hard work. Okay, good. Take note of this x-ray like we're sitting on the tongue. The involvement here of the lower right wisdom tooth is directly related to energy level, peripheral nervous system, and the ileocecal region of the small intestine. There's also a root canal which showed infection, which is directly related to stomach and spleen and pancreas function, along with the large amount of metal which is in the mouth and of course all this was removed along with the wisdom tooth and the root canal in this area. The uppers were taken out and a denture was placed, a crown was placed on one of the bicuspids so that we could use that for retentive purposes. Now we'll get back to Mr. J. Hey, Mr. J, just give us a rundown on the results that we've obtained for you.
Well, I was going to say here, 2 or 3 months ago, a guy asked me how I felt since I had all this silver removed, you know. And I said there was no difference. And a month later, that's when I started feeling better. You know, my appetite picked up, and my wife, she said I haven't ate like this and had this much energy since we've been married, you know. So, and I'm sincere when I say this. I feel better right now than I have since I can remember, you know.
Yeah. Was there any difference in, say, sleeping? Did you notice?
Well, sleeping, I never had any problem sleeping because I was always so worn out, completely worn out all the time. And when I'd get up, I would still be tired, you know. But as far as sleeping, I never had any problem with sleeping.
Okay, that's real good. Thank you for this interview, and we'll be following your case along at a later date. Okay, this is Mrs. B. Came to me at the tender age of approximately 6, at which time we had no cavities. She started her first fillings at age 6.5 or 7. And at the when you noticed what migraine type headaches at when you were
When I was about freshman in high school.
freshman in high school, and how often did they come, the headaches?
Then I probably got them maybe once or maybe twice a year. And then they didn't last very long, for maybe a couple hours. And then later on, a couple years after that, I was getting them more frequent, maybe 4 times a year. And they last several hours, from 6 to 10 hours.
Yeah. All right, in 73 and 75, more fillings were placed, occlusals and facials. She has an excellent dentition, except for some breakdown. And then what, you had a diagnosis? You went to an MD, Dr. Stuff and Bondwell, and what did she explain to you?
I explained the symptoms that I had. I had the blacking out in part of my eye. I couldn't hardly see anything for vision, likewise. And then also it usually start on one side of my head, and then the whole thing.
Was it pain and discomfort in that area?
Yeah. And then she explained what had happened as far as the migraine type would go, and the blood vessels and this would restrict and dilate. And then she gave me some pills for it, but then I never did use them because then I had all my silver taken out, and then my migraines just ceased. I had no more migraines since then.
Okay. And now, how long have you been free of headaches, approximately?
Almost a year now.
A year. Okay, basically that's all we really want to cover on this. And as we checked you out on the dermatron, it indicated just exactly what you're telling us, that it's a very heavy influence on the nervous system. And now we brought you back to better health.
Yep.
Okay. This is Mrs. P. that came to me about 8 weeks ago, and we looked over her mouth, and she will give you her health condition, and then we'll show her x-ray, and then we'll come back and she will tell you the change that she has noticed. If you will, please go ahead and tell us how you felt in your condition before we looked at your mouth.
Well, I had a lot of pain It wasn't only in my mouth, but it was the lungs too. And since I had the teeth out,
But what you said you used medication to what, breathe
Preventol,
better?
to breathe better. And
Was it mainly lung problem that you noticed?
yes, yes.
Okay, what was it, shortness of breath?
At times.
And did you have that checked by an MD?
Yes,
And what they recommended, what medication for you?
Preventol.
Is that the name of it?
Yes, spray.
It's a spray, huh? And that's supposed to what?
Well, that opened the passage into the lungs.
Okay, real good. That was the big thing that you noticed. That was
Yes,
your biggest
yes.
problem. Okay, now we'll show your x-ray and then we'll come back to you, okay? Okay, this is the lower right side involving the right lateral and a portion of the right cuspid into a abscess formation. The relationship, the lateral is to the rectum, anal canal, and this associates with lung function, along with the cuspid, which is related to liver and gallbladder. Now we'll switch back to the patient. Ms. B, we're ready for you now. Tell us what you've noticed since the removal of the crown and the removal of the infection. And it's about what, 4 weeks now? 5 weeks?
4 weeks, I think, or 5.
Mm-hmm. Okay, that was done 9/24/86, and we're looking at 11/5/86. Okay, what have you noticed now?
Well, I notice I sleep better. I used to have to get up at night and spray my throat because I was, well, nervous too. And I go back to bed and I could fall asleep. And I don't have to spray my throat anymore. And I feel a lot better.
Energy?
Yes. I'm just a different person.
That's wonderful. Mrs. MC, you're on. Go ahead.
Well, my symptoms were, seemed to be my problems was, for one thing, sinuses plugged up a lot, stomach problems, bladder problems, tension, a lot of nervousness, and it seemed like all this went away after you worked on my teeth.
Were you taking any medication at the time?
Yes, I was. I was taking a prescribed medicine for my stomach, and I'd had x-rays. They couldn't find anything wrong, and so after you worked on
How about energy level?
my energy level was really bad. I would get out of bed maybe 7:30 in the morning, and by 11 o'clock I was out of energy. And so I would just drag the rest of the day.
So, what about your rest and sleep at that time before anything was done?
Well, it seemed
Did
that...
you sleep well?
No, not really. I thought I had a acute case of insomnia, but no, this seemed to help that a lot too.
Okay, we're going to cut to the x-ray now. Okay, in relationship to some of these symptoms, the lower left molar was a root canal. This is related to lung and large intestine. The large amount of metal along with some silver fillings gives a bimetal current in the area. The root canals on the upper right lateral, upper left lateral, and left cuspid are related to a rectum anal canal, urinary bladder, kidneys, and also to the liver and the gallbladder. which can be associated or seem to be associated with some of the symptoms that Mrs. MC just described for us. Now, let's just run down some of those things that you described for us as being problem. How about the nervousness and tension now? What have you noticed?
Oh, it's improved immensely. And my stomach is, I don't
Good.
seem to have any problem with my stomach.
Mm-hmm.
And
Urinary bladder?
my urinary bladder is so much better. It doesn't seem to be like an infection half the time. And the pain...
Are you being treated for a urinary bladder problem at all now?
No, I'm not. And I'm not being treated for my stomach.
No more medication?
No. No more medication.
What about pain and discomfort that you were talking about, joint pain or headaches?
It seemed to relieve my sinuses quite a bit, and I don't, they don't get plugged up near as bad as they used to. And I sleep better. My legs don't burn the way they used to. I just seem to have an overall
Feeling of well-being?
feeling of, a better feeling than
Okay. And sleeping?
sleeping. I sleep much better.
Okay, would you please just tell, go over your history that you had with that jaw problem and explain it the best you can.
Well, I used to have a pain like if somebody would take a pin or a screwdriver and run it up my jaw.
Show us about where that...
Right up in here.
Right up the side
up,
there.
see. And since Dr. Cook took care of it, and it took about 6 months or so, a year, and now I don't feel anything. It's
comfortable.
Comfortable, yeah.
Okay. In this case, we used the dermatron to locate the area of involvement, and then we went ahead with surgery on that, and that was back in 1983, and that was the area, I believe, number 20 was the tooth area. And how long had you had that pain before we did that?
About 3-4 years,
About 3 or 4 years, huh? Okay, and today's date is the 2nd of December 1986, so you've got about 3 years, not quite 3 years in on that. All right, this is a patient of mine, and she's going to give you a short description of her symptoms, and then we'll go through what was done, and she'll give you the results that she has felt and obtained since the work has been done. Go ahead, Lynn.
Well, my problem started about 26 years ago when I had a lot of denture work done. We had gold and silver bridge work done, and I started having severe headaches. And I talked to the doctor about it at the time, thinking that maybe the gold was my problem because I couldn't relate my headaches to any other reason. And he said no, but nevertheless my headaches did continue, and they've continued throughout these 26 years. And with the headaches, I gradually accumulated more problems. Allergies, fatigue, depression, constipation, just in general, really felt miserable. Went to various doctors, and of course, they never really treated me for anything other than the symptom. I was treated for allergies at one time, and I didn't feel better, but I felt different. And I stayed on that treatment for 4 years and decided that was crazy. Then I started in with the orthomolecular therapy, and that seemed to begin to give me some relief. I still had a lot of headaches, but some of the other symptoms would leave. I wouldn't be so depressed, and I could think more clearly. My memory wasn't constantly blurred. And while I was going through the last allergy testings, I bumped into a magazine which told about the removal of amalgam and mercury from your teeth. And at the time I thought it was really kind of far out. But it so happened that there was a lady that just whizzed in and out of the office, and she at that time was having this done. And she made some comments, and I thought, hey, I can really relate to what she's saying. But I didn't do anything more until by chance I brought my mother-in-law up here to Dr. Cook, and he also had more literature on the removal of amalgam. And I guess he took one look at me and said I didn't look too good and knew that I was suffering from something. And he suggested having the amalgam removed. And I thought, well, why not? You know, half my life is over and I have been miserable the first half. Let's see what we can do the last half. So we did. We started taking out the amalgam. I don't remember just which side or how much we started with, but I remember going home and we had the side where the wisdom tooth was. I went home that night and I could tell that there was a moving sensation. Something was happening, like something was happening in the outer atmosphere. I could tell there was something, a change going on. And I didn't really know what it was. I thought maybe it was a cold coming on or an allergy attack or something. But as we progressed in having more of the amalgam removed, I felt better and better. My ears would actually at times stop ringing, where before they would ring constantly. And the headaches would leave up. Otherwise, the headaches were almost continuously from morning until night. I would take at least 24 aspirin a day just to try and get through the day and not be an ogre around the house. And I realized I wasn't taking as many Anacin per day, and that really surprised me because that was the first time in many, many years that I hadn't been reaching for that Anacin bottle. And the more Dr. Cook had done, the better I felt.
Okay, how are you doing, say, presently?
I think I'm doing super compared to what I did, say, 2 years ago.
How about the headaches now?
The headaches are gone. I wake up in the morning and I have no headache, and it's hard to believe I don't have a consuming headache. My ears ring once in a while, but not continuously like they used to. My energy level is much higher. My husband said he's having a hard time keeping up with me. I have a lot more activities going. My interest, you know, is just, I want to be doing something all the time. And this is very unusual compared to the last few years.
The upper left wisdom tooth was removed along with the second molar and some of the silver fillings at the same time on the upper left, which seemed to give a very improved result immediately. The rest of the work is a root canal. Also, we found that the first bicuspid and the second bicuspid on this right side were abscessed. The bridge work that she spoke of is on the lower right side. That was put in about 20 some years ago, and the lower left side was put in also 20 some years ago when she noticed a reaction to the metals. This is Mrs. J, and all I would like to have her do is give us her symptoms before she came here, and then what she has noticed after the silver fillings have been removed. You just tell your own story. Go ahead.
Okay.
Well, for years I was bothered with sinus, and at times I couldn't breathe. And if I was eating or talking or something, it would just choke me because I couldn't, it would be dripping down my throat.
Oh, yeah.
And I couldn't bring out the words. And when I'd go to church, I couldn't sing.
Yeah.
And when I came down here last fall to get my dentures, then you told me that with all of that silver filling, that's what's causing my trouble. And you drilled it out, and you filled it up, refilled it with white, and that's a year now. And I haven't had a bit of sinus. There's no dripping.
What about at night with sleeping? Is it
And
easier?
sleep- Yes. And I always had a handkerchief in my hand, no matter where I went, day or night. And I haven't used a handkerchief or Kleenex or anything since.
Oh, thank you so much for this short interview.
And when I told people about this, they laughed. They said that isn't possible. But
Okay, I would like to introduce Mary, and she will tell her little story on vomiting. Approximately 5 times a day for 3 months. Mary, about when did that start that you noticed?
I noticed the vomiting did start. I had some dental work done in April.
And you had a baby, what, about
November.
November of 83?
84.
84?
Mm-hmm.
And then fillings works, that was done in April.
Mm-hmm.
And then what?
And
Is
then
that about when it started?
that's when after I looked back, right after the dental work, that's where it did start.
Mm-hmm.
Because before that I had gotten down to my regular weight and that, and I was perfectly happy. And then all of a sudden, I started this uncontrollable vomiting. I'd drink a can of pop and I'd go to the bathroom. I'd chew a piece of gum and I'd go to the bathroom. And I thought it was psychological. I went to a psychiatrist, and he told me it was psychological. And then, so I didn't even tell my husband until June. I was losing my normal weight, about 125, and I had gotten down to 108. And I was losing so much weight, and I didn't feel good. I had no energy. And my husband just thought our marriage was falling apart.
Yeah, when did you have the wisdom teeth out then? Was that
Okay, I had wisdom teeth
before you
pulled.
lost all the weight?
That was about the same time I had the fillings put in. This was all done in a matter of,
A couple of months back.
yeah,
May,
a matter
May
of
you
a
had
month
the teeth
even.
out.
Right. So I wanted to have the wisdom teeth pulled out right away. To run to the dentist.
Huh?
And he pulled 4 wisdom teeth out.
What, and then you came to see me in August, I think.
Mm-hmm.
Middle of
In August, right after I told my husband. And he had heard about you by accident because they were working on your house. But we were to the point where I was just accepting the fact that there was nothing that could be done. And I just kept getting sick. And
Okay, then we took the fillings out, I think it was in September. And how soon after the silver amalgam fillings were removed and replacement of a silicon phosphate material, it's a white filling material, was placed, how soon did you notice an improvement?
right away I noticed an improvement.
What, within what, how many hours or days?
Well, the next day, that day I didn't get sick. And I thought that was just by luck, but then the next day I didn't even have the shakes, I didn't have the urge. But I still thought about it for a long time after that.
What, how long then after that, then you started gaining weight again? You were
I
down
started
about-
going back to my normal weight, then I was down to probably about 105, 103.
What, and then you said you had a sore tongue and sore throat?
Okay, yeah, my throat, in fact, doctors were all telling me that I had a thyroid problem because everything was so swollen. I had so many sores in my throat at the time. That's from getting sick for so many months. But that started clearing up then too.
Then you came back up and we did some surgery on those areas.
Oh, because of my
Wisdom
teeth infection that was still left in there.
Now there was residual infection left in there because of the silver fillings now. You got to clean them. How long before the sore throat and the tongue shaped up after the surgery?
That was a matter of a few weeks. I haven't had a sore throat since then. Yeah, it's 2 years. A year and a half about.
Yeah, it's about what? It's a year and a half since we took the silver fillings out. And now you're expecting another baby pretty soon. Really good.
But I just wanted to say that when after you did take the fillings out, it helped me. I didn't have to throw up anymore. I didn't have the shakes, and it wasn't physical. Mentally, I still thought about it because I did do it for so long. But now I can conquer it, which I couldn't have conquered it before. I was just accepting the fact that I didn't have long to live. And now I've conquered it, and I've...
Okay. Thank you so much for this interview. Really appreciate it.
Thank you.
This is to introduce you to Dr. Bowles' texts, and the text that I feel will give you the most descriptive detail and direct approach on this whole phase of his technique is the interrelationship of odontones and tonsils to organs, fields of disturbance, and tissue systems. The other texts are more in detail as to the anatomical positioning of the acupuncture points. Also, there's charts which give you a very, very good description of it. The teeth and the body, the energetic interrelations, is an excellent chart which is in the first text that I recommended. To give you just a little more detail on it is the relationship of the teeth to the organ and tissue systems. I'll just scan through that. It's available on charts which I can send or will be included with this tape, and you can then look it over at your convenience. The latest piece of literature that I've been able to get a hold of is by Dr. Ratner and a group of his colleagues, which have been working with alveolar cavitational osteopathosis and its manifestations of infectious processes and its implications in the causation of chronic pain. Of course, this would be directly related in my case. So I'll get back here to a little wider angle view of the charts on the wall, and we can get in just a little closer on them to show the acupuncture points on the hands, which go ahead and describe the lymphatic system, lung, large intestine on the index finger, nerve-related points, circulation, allergies, organ and tissue systems as we're going across the hand on the ring finger, and the endocrine system on the ring finger. The little finger has points related to heart function and small intestine function. The feet are spleen and pancreas on a large toe coming across. We have the liver, articulation of the joints, stomach, fibroid degeneration, skin-related problems, fatty degeneration, and the gallbladder. And as we get to the little toe on the inside is kidney-related and urinary bladder. This will give you just a quick overview of some of the material that's available. The rest of this can be picked up in seminars. In closing, as you can see, many of these patients have gone from health profession to health profession to find an answer to their problems. And I don't say that this technique is the total answer to everything. However, it has many good points which need to be brought out either in the teaching institutions or in seminars for the rest of the health profession. Hopefully this material will get into those hands and we can do more for our patients. Thank you very much.